Thank you, Rich. Our next guest is firmly against a government health care option and is mustering his forces to fight any effort to put it in.
Joining us now is Republican Representative Dan Burton of Indiana. Well, Representative, it didn't pass here with the two Senate Finance Committees. You know, some would say that there might be a chance, but it doesn't look good at this point. Tell me what you are so against here with the public option.
Well, Liz, I've talked to a bunch of doctors, and I would say a large percentage of those are very concerned, especially family practitioners. They're very concerned that they're going to lose up to $16,000 a year if that public option is put into effect. And there's an awful lot of doctors that have indicated to me that they would leave their practices if we get that option put in there, the Congress, and if they don't do something about tort reform. As many as 40% of the doctors around the country are saying that they would consider leaving their position if something like that passed, because it would just decimate their practices and their incomes. So I think there's a whole host of reasons, not the least of which, of course, is that seniors, I think, would see rationing. I think that you know, when you take $400 or $500 billion out of Medicare Advantage and Medicare to put it into the new public option, I think that that's something that seniors realize is going to cost them a lot of their services.
Representative, we do just want to clarify something, that the survey that you cited saying that 40% were against it. You know, there are some surveys that have been discredited at this point. So sticking to the positive ones that have been credited, that do have some support, you know, it's important, though, because there's a lot of misinformation flying around. Doctors, I'm more interested in hearing from the doctors. We had a Dr. Braverman from here in New York at the Cornell Center, and he, too, feels that there's way more that we need to tackle first, such as obesity and some of the serious problems. And if the government got on the preventative measure first, that might be much more useful.
I agree with that. Yeah, but let me just say this, Liz. I talked to a number of doctors in my district. I had meetings with them. And I can tell you, just from the 5th District of Indiana, the overwhelming number of doctors are very, very concerned about this and do not want the public option. Now, I've seen those polls that say 67% of the doctors are opposed to it and 40% said they would consider leaving their practice. Those may be erroneous. I don't know. But the fact of the matter is, I know an awful lot of doctors are very much opposed to this.
Well, and the more the American public learns about the public option, the less they are inclined to accept. In fact, the Rasmussen poll just out yesterday said 56% of Americans are opposed to it. If the Democrats go against the wishes of those committee members today who voted against the public option, if a public option is passed, what is likely to happen to Democrats? Would they be shooting themselves in the foot?
Well, you know, David, that's a very good question, because this bill will not go into effect until 2013. And I think they'll try to put the best face on it if they pass this thing so that they can get reelected. But I don't think the American people are going to be fooled. They realize that if this public option is put into place, there's going to be more taxes, there's going to be rationing of health care, and seniors are going to see Medicare Advantage and other Medicare coverages cut because of the $400 or $500 billion that are going to be taken out of Medicare and put into the public option.
But are we going to have a redux of what happened in 1994, where the Democrats essentially were swept out of office because of basically the same issue?
Well, you may rest assured that those of us in the Republican Party and the people across the country that oppose it, who are independents, we're going to tell the story. If they force this thing through, the American people are going to be very well aware of how they voted, and I think it will hurt a lot of them.
Representative, do you get the sense that the Republicans can come forth with something that's cogent and cohesive that might be able to get more traction with the American public? Because we haven't seen that yet.
Oh, Liz, we've come up with 2 or 3 bills that are very good. They allow the combining of businesses together so that they can get better rates, like major corporations, being able to buy insurance across state lines. I heard earlier they were talking about 2 major companies control the insurance, I think, in Massachusetts or Connecticut. Well, if we allow companies, small business people, to buy insurance across state lines, that'll put competition in the system. Medicare medical savings accounts, which will give people tax deductions for putting money into the medical savings account along with their employers. That'll be their money that will only be spent if they want to spend it for medical expenses. There's a whole host of things that we've suggested that would be a real plus as far as solving the medical expense problems. And then as far as those who are below the poverty line, who are indigent, we're going to have to provide a safety net for those. But it's probably more like 10 to 15 million that would need that.
Okay. Thank you
Congressman
so much.
Dan Burton, good to see you again. Thanks a lot for being here, Congressman.
Thank you very much.
Liz, David, good being with both of you.
Thanks
Welcome
so much.
anytime. Is all this talk about the government option distracting lawmakers from the real issue confronting America? What to do about soaring